you very much. Yes, you can find the details of the monitoring that I did on my website. There's a link on the homepage. There are lots of things that could be said about this. So I'm just going to focus on a few aspects of it that I found particularly interesting. The first one really relates to the autocratic nature of Arab regimes, because I was curious to see how they would handle a situation like this in comparison with countries with more democratic systems. And initially, the autocrats had some advantages. They were able to take drastic action at an early stage. There were border closures, curfews, internal travel restrictions, things like that. So there was less dithering than we saw in Britain at the time. But what came after that was really huge problems with non-compliance by the public. And the problem is that governments can't deal with the pandemic all on their own. They also need active cooperation with the public. And the relationship between Arab governments and their publics is not really conducive to that. People tend to resent government decrees and instinctively look for ways around them. And social distancing is also a difficult concept in our culture because sociability is very important. And there was a lot of resistance where people were holding illicit wedding parties and that sort of thing. And the cost of this non-compliance could be very high. There was a notorious case of a truck driver in Jordan who had come back from Saudi Arabia. He was given a test on the border, which came back negative. But because of the time lag, he was told to self-isolate at home pending a further test. And he signed a paper agreeing that that was what he would do. The driver then went on, this was during Ramadan, he went on to host an iftar banquet before his second test had been done, and the second test proved positive. And the result of his iftar, at least 90 other people were infected in Jordan. One was a nurse working at the hospital, she was a relative of the driver, and that caused great alarm in the hospital. Another person infected was an ice cream distributor who had passed the virus to a shopkeeper, and that then led to 38 ice cream shops in Jordan, all being closed down. I'm not suggesting this was all willful non-compliance, because there were a lot of people who were simply unable to comply because of their financial situation or their living conditions. But I think the compliance problem was exacerbated by our governments, who always like to try and get the impression that everything is under control. And they put a lot of emphasis on visible signs of the government doing things. So in Egypt, for example, you have photos of the Pyramid Plateau being sprayed with disinfectant. In Syria, you have pictures of vehicles driving through pools of disinfectant. So all those kind of visible things. And also, governments made a point of highlighting the number of people who had recovered from the virus alongside the numbers of new infections. And in fact, occasionally in the newspaper, we'd find the first item in the report was the announcement of the number of recoveries. The other thing to note is that where I think in European countries, cooperation is achieved mainly by persuasion and giving information, in the Arab countries there was a heavy reliance on threats of punishment, imprisonment, and very large fines. The next thing that I found interesting was concerned with religion. There were a lot of problems in Israel with the ultra-Orthodox Jews, but surprisingly, there seemed less of this in the Arab countries. The Saudis, for example, handled the situation pretty sensibly. They reorganized the Hajj to greatly reduce the numbers, and throughout the region there was closure of mosques, certainly for communal prayer. One exception to this was in Sudan, where the governor of Khartoum was dismissed for refusing to implement a ban on group worship. Technology is a third interesting aspect that I found. What we saw was a huge increase in e-government and e-commerce. And these are really quite important because I think they will continue. And the more e-government you have, the less scope there is for petty corruption involving officials having to bribe them for documents and all that sort of stuff. And obviously with less cash transactions, you have the possibility of less tax evasion and fraud and that sort of thing. What we did see on the technology side, though, was some really scary surveillance, particularly in the Gulf states. In Bahrain and Kuwait, people had been ordered to isolate, had to wear special wristbands to keep them under surveillance. This is a bit like the electronic tagging of offenders that we have here. Under Dubai's lockdown rules, people had to apply online for permit every time they wanted to go shopping. So applicants had to say where they intended to go, at what time they're going, at what time they thought they would come back. And in a further attempt to track illicit movement, the speed cameras in Dubai were adjusted to photograph all vehicles passing them, even if they're not speeding. The last point I just want to raise is about migrant workers, because this is a particular issue in the Gulf states, that there were disproportionate numbers of infections among the migrant workers. It was a sensitive issue and it was generally underreported. But it raised an awful lot of questions about the living conditions of the migrants. There was also a certain kind of discrimination. For example, in Kuwait, citizens who tested positive were sent straight to a state-of-the-art hospital. But non-citizens had to go to a local hospital for assessment. And if you were a non-Kuwaiti man and you weren't seriously ill, you would then be sent to an exhibition centre where there was a field hospital. So there were considerable differences in the treatment there. I will stop there, I think.